An essay, as opposed to a case study, usually has a question or a thesis which defines the boundaries of what you research. You aim to keep it within those parameters, and you delve as deeply as you can into the material. It loses focus if you include stuff outside the topic. With a case study, however, your focus is the patient, so you need to cast your net widely and generously at first, to find something that is relevant to them. And then, when you find something relevant, you need to research deeply. So, doing a good case study report involves a lot more reading than you might think. You'll have to research both generally and deeply. There can be a lot of research, and fairly unguided research, involved in a case study. Don't assume it's like a reading comprehension exercise. The problems are not always clearly defined, and the solutions have not necessarily been covered in lectures. Think of your case study as a mystery puzzle with a few clues scattered through it. In reality, patients do not arrive with instructions, so it's up to the professional to notice what is not obvious and to think outside the box. It is up to you to anticipate problems for the patient. It's up to you to follow through with the threads of any clues and to see if they offer any valuable information. And these may only be hinted at indirectly. With years of nursing experience, the clues and danger signs get easier to spot, but it is very challenging for a beginner if you don't know what to look for. And that is why the broad reading is important. So, every piece of information about your patient is valuable. When the information is given in the assignment, the facts are not random facts. They have usually been included for a reason. So, use them, and use them as much as you can. You may, on the other hand, have been told very little in the assignment and be expected to elicit the information yourself from the patient through a blog or a question and answer session. Asking for more details about their condition just gives you more details about their condition, and unless you have some reasoning in mind for asking about that, more details per se is usually not that helpful. Instead, ask about things that may affect the treatment or recovery. Ask about things that may complicate matters: smoking, relevant illnesses, lack of family support, strenuous lifestyles, or jobs are all factors that may generate important decisions about how the patient is treated or cared for. The secret to keeping it about the patient is to keep them foremost in the discussion. You do this by making them the subject of each paragraph, and you do this by making them feature in the topic sentence at the beginning, and, if possible, a summary sentence at the end. In the middle of a paragraph, you have more flexibility to talk about the procedure or the condition in a more general way. But at the end of the day, you need to remind us of how this is important to your patient. If you don't, your writing becomes an essay rather than a case study. And if you feel like you're being asked to research and to discuss material that is not directly relevant to your patient, you can make it relevant by at least explaining why it is not relevant. Remember, everything you write about should be in relation to your patient. So remember, it is all about the patient. Keep everything relevant to the patient. Keep the patient in mind throughout the research and the writing. Explore and discuss what the question requires. But theory for the sake of theory should be avoided. Your mission is to find the best solutions available for your patient and develop the best understanding that you can of your patient. You have now completed the case study module. We hope you have enjoyed the content. For more study skills resources, please visit the RMIT Learning Lab.